And a meta-analysis, so this is a pooling of a whole bunch of different studies together, consistently shows an association between postpartum depression and insecure attachment. Some of you in the room who may know a bit about attachment theory, this is about disorganized attachment. How many people here know a little bit about attachment theory? There you go. So this is talking about disorganized attachment. And postpartum depression impairs a mother's capacity to provide sensitive responsiveness in relation to the child's attachment needs, especially around separation. And we think that this impaired attachment to the primary caregiver, which is often the mother, may lead to negative effect on the brain's development, both the physiological and the actual structural development of the child's brain. An altered stress reactivity pattern in their brain, and an altered social, emotional, and neurocognitive development pathways. So we think that this attachment is really crucial for proper brain development. We know that how people develop their attachment styles, that occurs within this first 3 years of one's life, and that will remain with them into adulthood. So attachment styles develop early and is based on interactions with the primary caregiver, which is often the mother. I'd like to also mention at this time, I've been talking about the consequences of postpartum depression, but there's a growing body of research out there that's clearly suggesting that antenatal depression impacts all these outcomes that I was talking about. So antenatal depression has been associated to the child's poor cognitive developmental outcomes, these behavioral problems that we see, and also poor mother-infant attachment. But we also see in some relationships between poor obstetrical, fetal, and neonatal outcomes. So not these long-term outcomes, we're also seeing some short-term implications as well. We see an alter in the cortisol as the baby's brain is developing, and we know that that's linked to poor developmental outcomes later on. High levels of cortisol, which is a response to stress in utero, leads to these poor developmental. Cortisol is very toxic for brain development. And we can talk about the HPA axis. Some of you may know about these mechanisms, but this is developing in utero. So we know that during pregnancy, exposure to maternal depression can be very negative on the child's development, not only in utero, but long term. And so we really need, when we think about postpartum depression, I think we need to be broadening it, to be thinking about perinatal depression. And I'm talking to John Cox, and he developed the postpartum depression scale. And he says, I shouldn't have called it the postpartum depression scale. I should have called it the Edinburgh perinatal depression scale. Okay, and we'll talk more about that. But I just really want to highlight, even though today's talk is on postpartum depression, that antenatal depression matters, and we need to be focusing on this clinically as well. I also like to bring your attention to the fact that postpartum depression is a family affair. Not only does it impact mothers and subsequently children, but it also impacts the partner. A meta-analysis published in JAMA a couple of years ago clearly indicated that approximately 10% of fathers will also experience depression in the postpartum period. Now, the prevalence time point is within the first 12 months, so it's not within the first 12 weeks, but it's the first 12 months. And this rate is significantly higher than the 12-month prevalence of 4.8% found in the U.S. database that's population-based. So the general population level rates for depression in men is sitting around 4.8%, and in that first year postpartum, the prevalence rate for depression in men increases to 10%. So significant distress for fathers as well. Some evidence suggests that postpartum depression begins in fathers later than it does in mothers. So often what we'll see is that the mother will develop the postpartum depression, then later the father will develop postpartum depression. And Cheryl Beck, has anybody heard of Cheryl Beck in this room? Some of you? She's a qualitative researcher in the States, and she's done some beautiful work around postpartum depression, some qualitative studies, so talking about lived experience. And she did a great qualitative study with fathers. outlining how do fathers develop postpartum depression and the steps that they go through in the development of it. And it starts off with, they come home and they're expecting a very positive home environment with this new baby, and then the mother develops depression, and he does everything he can to try and help her with the depression, and he finally realizes that he can't help her, and he feels like he's lost his partner, and then consequently he starts to feel a sense of hopelessness and helplessness and develops the depression himself. That's a general overview of the different stages that she's outlined, but you can see how it's challenging to live with a depressed individual. And men have different distribution of psychiatric disorders. So we're not 100% sure how do we detect postpartum depression in fathers, because they're more likely to rely on substance abuse and more likely to display anger, whereas a mother's more likely to cry. Men are less likely to cry. So these traditional symptoms of postpartum depression, we often don't see that in men. They display it very differently. And so, and we haven't studied this very well. But we think that there are some common risk factors related to postpartum depression that I can share with you today. This is just based on some of the review of the literature that I've done. This is not a meta-analysis, but we see a history of depression, which is very similar to mothers. So if the father's had a history of depression independent of childbirth, then he's at greater risk of having another depressive episode. That's the chronic recurring component of depression. If the father was depressed antenatally or high levels of anxiety antenatally, very similar to mothers, then increased risk. If the partner was depressed, so that's very unique. That's not a risk factor for mothers for postpartum depression, but it is for fathers. Poor marital relationship, very similar to mothers. And we don't know if it's the poor marital relationship that started a long time ago that leads to postpartum depression, or is it postpartum depression leads to the poor marital relationship? We do know with studies that we followed couples across the postpartum period and we measured marital satisfaction, we do know that it consistently declines as the year progresses, with the ultimate low being 1 year postpartum. So but we don't know if that's related to the postpartum depression or not. That literature is not very clear, but we know that it's a very stressful home environment. What's really interesting about some of the risk factors is this low perception of parenting self-efficacy. So fathers that feel very stressed and don't have a lot of confidence in their ability to care for their children are at increased risk of postpartum depression. I think that's a really great risk factor because we can modify that risk factor. That's a very modifiable one and can start antenatally or early in the postpartum period, but preferably antenatally, engaging the father in how to care for the child after the birth of the baby. That's where prenatal classes come into play, but we know that there's often a decline in people attending prenatal classes, but antenatally would be a time to be able to target that risk factor. High parenting stress often goes hand in hand with these low levels of parenting self-efficacy. And interesting that it came out specifically, lack of information about pregnancy and childbirth. So we see that there's knowledge gaps for fathers that can be targeted antenatally, but fathers who are going into fatherhood not prepared are at increased risk because they don't know how to deal with the home environment and caring for the children in the early postpartum period. There's evidence beginning to accumulate that fathers can also have a negative impact on child development. Fathers' roles vary widely between and within different social and cultural groups, but in most countries now, fathers are playing an active role in child care activities. That's probably related to the fact that 70% of mothers who have children under the age of 5 are working, either part-time or full-time. So mothers are in the workforce. A lot of mothers are not stay-at-home mothers. They're working, and so fathers are actually engaging in child care activities as well. We need a lot of different types of co-parenting activities here. And so when we see that a father has a psychiatric illness, such as postpartum depression and mental illness, this increases the risk of the children having poor developmental trajectories. So for example, paternal parenting behaviors. Depressed fathers are more likely than non-depressed fathers to spank their babies, to spank the children, to not read to the children. We know that that's important for cognitive development. To not play outside, so there's your stimulating environment.